keeping Lynchburg in the know. This is Ask the Expert on Lynchburg's news and information station, 105.9 WLNI.
We're here at Riverside Veterinary Hospital. Dr. Laura Ryan is our guest on Ask the Expert. Of course, Riverside Veterinary Hospital on Route 460 in Good. I think we can all relate to problems associated with arthritis, but we don't often think, Dr. Ryan, about how that affects our pets.
Right. Arthritis affects all of us. Of course, arthritis is inflammation of our joints. It's where cartilage gets worn, and then we get bone ends contacting each other and rubbing, and of course, bone on bone is painful. And then we know we can't stop arthritis, but we sure can try to control it. Let's talk about 7 signs of common arthritis. First of all, you might notice your dog limping. Of course, older dogs usually get this, but sometimes the younger ones can be affected. Second of all, difficulty moving around. You notice it's hard for them to get up, and then once they get up moving around, they seem to be doing a lot better. Maybe they have issues such as a sore neck or abdomen posture. They're kind of walking like a Halloween cat. They're telling you that they're hurting. Maybe they seem more tired than usual. Okay, yes, they're older, they sleep more, but also, if you're hurting, you're going to sleep. So that's another sign of arthritis. Irritability. Typically, good dogs don't care if the kids jump, pull on them, whatever, but then as time goes on, you start to notice they get a little nippy. Well, they're telling us they're hurting. You also might notice muscle atrophy or wasting. That's where the muscles, especially in the hind legs, especially of our bigger dogs, they start to get smaller because they can't use them like they used to. And then finally, another common sign is your dog or cat can start licking, chewing, biting at that body area that's hurting them, such as the wrist area. But there's lots of medicines, different things we can do to help arthritis, just like people. We like natural supplements such as glucosamine chondroitin. We also use non-steroidal anti-inflammatories. You would want to have your dog examined and some blood work done for long-term drug use. So just come on by and let us take a look at your geriatrics, especially your geriatrics, because they're very important to us. In fact, we're working on a water therapy pool for them in the near future.
More on that coming up as we continue with Dr. Laura Ryan on Ask the Expert here from Riverside Veterinary Hospital. Online at riversidevetHOSP.com, or you can call 540-586-5545.